Hello, my name is Claire Ahimbisibwe. I'm a Neonatology Nurse Fellow at Mulago Specialized Women and Neonatal Hospital. In this video, I'm going to be demonstrating developmental positioning of preterm babies in the NICU. NICU is the Neonatal Intensive Care Unit. However, the lower health centers have a special care unit or neonatal care unit. The nesting is one of the core pillars of the neurodevelopmental care that is very important for preterm babies. To make a nest, we use soft, warm bed sheets and then a baby. For our case, we are going to use a dummy, as you can see, who is going to act as a baby. So we need to know about nesting because it promotes growth, and then it helps the musculoskeletal system of the baby so that the babies grow up to have firm muscles, and also helps the babies to minimize stress, especially when they are able to soothe themselves, when they are in a comfortable position, when they have boundaries as if they were still in the uterus. To make a nest, you have 2 or 3 bed sheets and you fold them halfway to the bed sheet, the size of the bed sheet. So you have it, put it on a firm surface, and then you turn this to make a U, as you can see. And then also this side, you turn it to make a U, as you can see. So there are these separate flaps that remain. You can bring them together and turn them inside. The same way you did the other side, turn them inside. So for small babies, we need an extra 1 or 2 bed sheets that will help to create the boundary to contain and support the baby's head. So our bed sheet is already folded, as you can see. So you bring it above this and you tuck it inside this one that you've already made. So your nest should be looking like this. So this is your nest. So in a supine positioning, we need a bed sheet that will work as a support to the neck, because preterm babies have softer necks and longer necks, so they usually are flexed easily. So we need to avoid that so that we do not obstruct the airway. So that's why we need an extra bed sheet that we put down to work as a shoulder pad or a neck pillow. So you can either put it like this and you put it on the side. So you bring your baby gently in a flexion position, maintaining the midline orientation, and then you put the baby in supine position. So supine position, the baby lies on the back. So you fold the knees and the hips are flexed into this nest, this angle of the nest, so they are contained inside. So yeah, the hands of the babies are kept near the baby's mouth so that it's easier for them to soothe themselves, which is very important because it helps to minimize their stress levels. And then this can be used to contain the baby in a position. So you either tuck it in on one side so that it's contained. So the baby's hands are near the baby's mouth, as you can see. So in another position, which is the side lying position, we are going to put the baby on the side, lying on the side, maintain the midline position as well. So the baby is turned to face on one side. You make sure the face is very visible and not obstructed by this nest. The legs are still flexed inside the nest, and then you use this to keep the baby in a position. So this can be passed in between the legs so that it provides a very comfortable position and support. So the leg is maintained inside. As you can see. So for our babies, they're able to maintain their hands on the chest or near the mouth. So this is the side lying position. So next we are going to go to the prone position. So in prone position, we are going to remove the baby gently first. So we need this bed sheet to create a softer cushion kind of on below the baby's tummy. So we fold it in this way. We put it in between our nest and we carry the baby gently. So we carry the baby gently, maintaining the positioning, and the baby is put to lie on the tummy with the head turned on one side. So this bed sheet that we created down is able to keep the hands or the shoulders of the babies are able to flex around this bed sheet, as you can see. And then the hips are still flexed and the legs are bent inside this nest to still provide the containment that we need, and also in the flexion position. So this one helps to also cushion the baby on top, so you can tuck it inside. Remember, our baby's head is turned on the side. For our dummy it's very hard, but for a baby is able to turn on the side. So you put this to also keep the babies, to contain the baby inside the nest. So one important thing to look out for the prone position is it needs to be supervised. Yes, it's very important because it also is very comfortable for the baby, but it needs to be under supervision. So if the nurses are able to supervise, then it's okay. And this prone position increases oxygenation for the baby, so hence maintaining growth of the baby, reducing on the energy the baby needs to use. So some of the benefits that we looked at of these different positions is it helps to promote the muscular skeletal system of the baby. So the babies grow up into firm and they are able to catch up with all the stages of development. Then another thing is this nesting helps to reduce stress of the baby because they are contained in a nest that is very soft and creates a boundary around the babies, so the babies feel protected as if they were still in the uterus. Also, this nesting promotes a sleep-wake cycle that is very important for the babies to continue growing and put on weight. Once the baby is very comfortable, they are able to sleep more hours. So every nurse or health worker in the NICU needs to practice how to make the nesting in different positions so that we are able to maintain growth and neurodevelopmental care for the preterm babies under our care. Thank you.